Have you ever felt anxious? Ever felt you had trouble sleeping, eating, or concentrating? Maybe you have a big exam coming up, or you're undergoing stress in your personal life. Everyone has experienced some sort of anxiety in their lifetime, but imagine feeling that way all the time, even if you have no reason to be. That's what generalized anxiety disorder is for the 6.8 million adults, or the 3.1% of the U.S. population it affects. Mayo Clinic says that it is normal to feel anxious from time to time, but excessive ongoing anxiety and worry that interferes with day-to-day activities may be a sign of generalized anxiety disorder. People who suffer from GAD experience chronic and exaggerated worry and tension, even though nothing seems to provoke it. Having this disorder means they are always anticipating disaster, often worrying excessively about health, money, family, or work. Even though these are things I usually worry about, sometimes the source of the worry is hard to pinpoint. Another problem with this disorder is that it often disrupts daily functioning. I will go more in depth about symptoms, diagnosis, and treatment of GAD in this speech. There are many symptoms associated with generalized anxiety disorder. GAD sufferers can't seem to shake their concerns or relax. They also have an unrealistic view of problems and are irritable a lot of the time. Physical symptoms that are also included in their anxiety are fatigue, headaches, nausea, muscle tension, trembling, sweating, lightheadedness, and feeling out of breath. On Psych Central, it says that GAD comes on slowly and hits people in childhood or adolescence, but it also can begin in adulthood. Usually the impairment with GAD is mild, and the sufferers aren't too restricted in social settings or on the job, but when it is severe, it can be debilitating, making it difficult to carry out even the most ordinary daily activities. Now that I've discussed some of the symptoms associated with GAD, I can move on to how to diagnose an individual showing GAD. There are a number of different things that a doctor can do to diagnose GAD. If symptoms are present, the first thing that they will do is begin an evaluation. In this evaluation, they will begin asking questions about your medical and psychiatric history and perform a physical exam. They do a physical exam to look for signs that might be linked to another medical condition. To be diagnosed with GAD, you must meet criteria in the Diagnostic and Statistic Manual of Mental Disorders, which is published by the American Psychiatric Association. The DSM-5 criteria for GAD includes excessive anxiety and worry about several events or activities most days of the week for at least 6 months, difficulty controlling your feelings of worry, at least 3 of the following symptoms in adults and 1 of the following in children, restlessness, fatigue, trouble concentrating, or sleep problems, anxiety or worry that causes you significant distress or interferes with your daily life, anxiety that isn't related to another mental health condition. GAD often occurs along with other mental health problems which can make diagnosis and treatment more challenging. Now that I have discussed how GAD is diagnosed, we can move on to how to treat GAD. There are a number of treatments available to people with GAD. Medication and cognitive behavioral therapy are the 2 main forms of treatment. The 2 main forms of medication that are available to people with GAD are benzodiazepines and antidepressants. Benzodiazepines remove intense feelings of acute anxiety and decrease the physical symptoms of anxiety. These type of drugs are most often used in the short term because they can be addicting. Antidepressants affect the neurotransmitters in your brain. They may take a longer time to start working, but they're safer and more appropriate for long-term use. Cognitive behavioral therapy is a good treatment because you learn to recognize and change thought patterns and behaviors that lead to anxious feelings. This type of therapy helps limit disordered thinking by looking at worries more realistically. Some other forms of treatment are yoga, meditation, and massages. In summary, I've discussed the basics of generalized anxiety disorder and the symptoms, diagnosis, and treatments associated with it. Anxiety is a totally normal thing that everyone has experienced, but once it starts to hinder your daily life, then it's time to maybe look to a doctor for help. Are there any questions?